What are the chances of autosomal recessive inheritance? Have you ever wondered how certain genetic conditions are passed down in families? One key concept in genetics is autosomal recessive inheritance. This type of inheritance occurs when a child inherits two copies of an altered gene, one from each parent. It's important to understand how this works, especially if there is a family history of genetic conditions. Let's break down the chances for each child when both parents are carriers. A carrier has one normal gene and one altered gene but does not show symptoms of the condition. For each child, there are three possible outcomes. First, there is a 25% chance that the child will inherit two normal genes. This means they will be unaffected by the condition. Next, there is a 50% chance that the child will inherit one normal gene and one altered gene. In this case, the child becomes a carrier like the parents, but they typically do not show symptoms. Lastly, there is another 25% chance that the child will inherit two altered genes. This is when the child will be affected by the autosomal recessive condition. This pattern of inheritance means that the condition often appears in siblings rather than in parents or other relatives. It affects males and females equally. The reason for this is that a single normal gene usually provides enough function to prevent symptoms from showing. In families where the parents are related, the chances of both being carriers increase. This raises the risk of having children with autosomal recessive conditions. If a family has a history of such disorders, genetic testing can help identify carriers. This information is essential for making informed decisions about family planning and can lead to early diagnosis or intervention if needed. Additionally, some individuals with autosomal recessive conditions may have two different alterations in the same gene. This is known as being a compound heterozygote, which can also lead to the disease manifesting. So, when both parents are carriers of an altered gene for an autosomal recessive disorder, each child has a 25% chance of being affected, a 50% chance of being an unaffected carrier, and a 25% chance of being unaffected and not a carrier. Understanding these chances is vital for families considering genetic testing and managing hereditary health.